Hello guys, welcome back to my YouTube channel. From this video, I will discuss about the anatomy of anal canal. The anal canal is the terminal part of the large intestine and it extends from the anorectal junction here up to the anal orifice. From anorectal junction up to the anal orifice. So you can see it is about 4 to 4.5 centimeters long. The anorectal junction lies in the pelvic cavity. The anorectal junction, that means this area lies in the pelvic cavity, but the anal canal lies below the pelvic diaphragm in the anal triangle of the perineum. Here in this diagram also you can see this is the rectosigmoid junction and this is the rectum. You can see peritoneal covering up to this area and this rectum continues as the anal canal. Here you can see the external anal sphincter, internal anal sphincter. Here this is the internal anal sphincter. This area is the ischio-anal fossa. When we talk about the relations of the anal canal, posteriorly it is in contact with the anococcygeal ligament and anteriorly it is the perineal body separates the anal canal from the lower part of the vagina in females and from the penile bulb and membranous urethra in males. As you know, on either side there are ischiorectal fossae. When we talk about the internal appearance of the anal canal, it is divided into three parts. As upper part, that means upper 15 mm in length, middle part, that means pecten, it is also 15 mm in length, and lower part 8 to 10 mm in length. Hope this diagram is more clear with regards to this internal appearance. The anal canal, whole anal canal divides into three parts as endodermal upper part, here endodermal upper part which is 15 mm long, then the pecten or the middle part, and then lower part. Here this is the altogether middle part and lower part is 23 mm long, but the pectum area it is 15 mm in length and the lower part is about 8 to 10 mm in length. When we talk about the upper 15 mm area, the mucous membrane of this part is lined by simple columnar epithelium. Mucous membrane lined by simple columnar epithelium and it is reddish in color and shows several features. Those features are, I will show you in next diagram. Here in the upper part of the anal canal, there are columns called Morgagni. These are the columns of Morgagni. These columns of Morgagni are, there are 6 to 10 longitudinal folds of mucous membrane. These columns of Morgagni are formed by the longitudinal folds of mucous membrane. Actually, each column of Morgagni contains terminal radicle of superior rectal artery and vein. These terminal radicles are well developed in the left lateral, right posterior, right anterior positions. Therefore, the piles are more common at these three sites. What are those three sites? The left lateral, right posterior and right anterior positions. Therefore, in these positions, the piles are more common. Next important feature is anal valves. Here, these are the anal valves. You can see these are the anal valves. Those anal valves are transverse folds of mucous membrane. Columns of Morgagni are longitudinal folds of mucous membrane, while these anal valves are transverse folds of mucous membrane and they unite by the lower ends of the anal columns. When you pass hard stools, there can be injury to these anal valves causing anal fissures. Then the third important feature in this area is the anal sinus. Anal sinus is this space. That means the space above each anal valve. The space above each anal valve are called as anal sinuses. Important thing about the anal sinuses are the anal glands open into those sinuses. These anal glands are called as anal crypts. Here you can see the anal crypt here. Here, this area, you can see the anal crypt. The anal sinuses on posterior wall are the deepest and therefore more prone to get infection due to fecal matter getting trapped there. And also it can cause abscess formation as well. Now you know the 4 important features in the upper part of the anal canal. Those are columns of Morgagni, then anal valves, anal sinuses and anal crypts. These are the anal glands which opens into the anal sinuses. The place where these glands open are called as the anal crypts. Then the fourth important feature in the upper part of the anal canal is the pectinate line. Actually, this pectinate line is here and it is a transverse line which runs all around the anal canal along the lower limit of the anal valves. These are the pectinate lines. This pectinate line is the dividing line between endodermally derived and ectodermally derived anal canal. So, above this pectinate line, there is endodermally derived anal canal. Below this pectinate line is the ectodermally derived anal canal. This pectinate line is also called as watershed line because it separates two entirely different parts of the anal canal in terms of the development, nerve supply, blood supply as well as the lymphatic drainage. So that line, pectinate line or the dentate line is also called as the watershed line. Remember that as well. Again summarize what are the important features in the upper half of the upper one third of the upper part of the anal canal. Those are columns of Morgagni, then anal sinus, anal valve, the anal crypts, anal glands and pectinate line. Pectinate line is also called as dentate line as well as the watershed line. Now let's discuss about the pecten part, that means the middle part. This part of the anal canal is lined by stratified squamous epithelium. This part of the mucosa is lined by stratified squamous epithelium and the mucosa is less mobile here compared to this upper part. This region is also referred to as transitional zone. Also, this zone is bit of bluish in color because of the presence of rich venous plexus underneath this area. And also, the white line of Hilton denotes the lower limit of pecten. In this diagram, you can see the white line of Hilton which denotes the lower limit of the pecten area. This is called as white line of Hilton because this area is bit of whitish compared to the bluish color of the pecten. This line corresponds to the intersphincteric groove in the wall of the anal canal as well. In this diagram, you can see the intersphincteric groove. So, this area is also called as the white line of Hilton. Next part or the lowest part is, it is the shortest part. This is the lowest part. Actually, it is the shortest part of the anal canal and is lined by true skin with sweats and sebaceous gland. This area. Now let's see about the anal musculature. The musculature of the anal canal is divided into 4 groups as internal sphincter, external sphincter. This is the internal sphincter, then external sphincter, then anorectal ring. There is something called as anorectal ring and the longitudinal muscle layer. This is the longitudinal muscle layer. You cannot see anorectal ring here in this diagram. Here you can see one important relationship, and it is easy to remember. I think from this diagram you can easily remember about the levator ani muscle, internal anal sphincter and the external anal sphincter arrangement. It is correspond to this diagram as well. When we talk about the internal anal sphincter, it is a thickened circular smooth muscle surrounding the upper 3/4 of the anal canal, and it extends from the anorectal junction to the intersphincteric groove, and also it is involuntary. When we talk about the external sphincter, it is voluntary muscle that surrounds the entire length of the anal canal, external anal sphincter, and it is divisible into three parts as deep superficial and subcutaneous. Deep superficial and subcutaneous parts. Deep part is located outer to the anal sphincter. It has no bony attachment as well, but its few fibers are attached posteriorly to the anococcygeal raphe. Here you can see very clearly the deep part, then the superficial part and the subcutaneous part. And the superficial part lies below the deep part and extend up to the intersphincteric groove. That means this part, the superficial part, is the only part of the external anal sphincter which is having a bony attachment. Actually, it takes origin posteriorly from the last piece of the coccyx, and it is inserted anteriorly into the perineal body on either side. It does not completely encircle the anal canal as well. It does not support the anal canal in the midline posterior. Actually, it is postulated to be predisposing factor for frequency of anal fissure on the posterior wall of the anal canal. When we talk about the subcutaneous part of the external anal sphincter, it is the lowest part of the anal canal below intersphincteric groove, and it has no bony attachment. This is the part which has only which only having bony attachment. When we talk about the arterial supply is from the superior rectal artery, this coming from here, and the inferior rectal artery. Inferior rectal artery is a branch of internal pudendal artery. It has shown clearly in this area. When we talk about the lymphatic drainage, here you can see this is a cartoon picture, and you can see the nodes, epirectal nodes here and pararectal nodes here, and then those drains into the inferior mesenteric nodes here, and also they drains into the internal iliac nodes as well. When we talk about the venous drainage, here there is internal rectal plexus and the external rectal plexus. Here the venous plexus drains into the inferior rectal vein as this in this diagram. These drains into the inferior rectal vein, then inferior rectal vein drains into the internal pudendal vein, then internal pudendal vein drains into the internal iliac vein. Here also those venous plexus drains into the superior rectal vein as here, and then superior rectal vein drains into the inferior mesenteric vein. Likewise, venous drainage is towards the through the inferior rectal vein and the superior rectal vein towards the internal iliac vein and the inferior mesenteric veins respectively. I told you at the beginning, in the columns of Mogagni there are the superior branches of superior rectal veins and the superior rectal arteries and the superior rectal veins. Here you can see the superior rectal arteries, superior rectal veins, and also there are nerves, the branches of the pudendal nerve S2 to S4. Here there is difference of nerve supply, blood supply the lymphatic drainage and venous drainage according to the development. I told you earlier as well about the pectinate line. It develops from the endoderm. Below that pectinate line, it develops from the ectoderm. You can see very nicely the upper part of the pectinate line drains from the drains towards the superior rectal vein and then to the internal iliac lymph nodes. This is the visceral innervation coming from towards the endoderm, and the arterial supplies from the superior rectal artery. When we talk about the below the pectinate line part, that means the part developed from the ectoderm, it supplies from the pudendal nerve, somatic innervation, S2 to S4, and the arterial supplies from the inferior rectal artery. The venous supply is from the inferior rectal vein towards the common internal iliac and then common iliac vein, and then the lymphatic drainage drains to the superficial inguinal lymph nodes. Those are the differences between the part developed from the endoderm and the ectoderm. You have to remember those parts as well. They are more important towards your embryology part. Yeah, that's all about the anatomy of anal canal. Hope you guys clearly understood about the anatomy of anal canal, how it divides into several parts according to the length wise or according to the development wise, and what are the various structures in the inside of the anal canal, as well as the anal musculature and the arterial supply, lymphatic drainage, and those things. So thank you for watching. If you like this video, put a like and comment in the comment section. And if you have another topic to discuss regarding anatomy, you can put it in the comment section as well. So thank you for watching.